Welcome back to Heart about everything lupus, where we discuss everything about lupus. I'm Susie Eaglesflight from Lupus South Africa and Andrew Skiff.
East is east and west is west, and the wrong one I have chosen.
Today we are talking about anxiety. About 37% of people with lupus also have been diagnosed with anxiety. I believe it's higher. Feelings of chronic stress can infiltrate your life, and these feelings should not be ignored. What should I do if I struggle with anxiety, you may ask? Stay tuned and I will explain.
Where I'll keep on wearing those frills and flowers and buttons and bows, rings and things and buttons and bows.
So get a cup of nice hot coffee or tea, put your earphones in, sit on a relaxing chair, and let the two of us discuss lupus. Anxiety is a sense of fear or panic that intrudes into your thoughts, keeps you awake at night, interferes with eating, and can make you feel sick. It's a response of chronic stress. So it's no surprise that people with lupus are likely to feel anxious. We've got the kids, we've got the house, we've got the husband, we've got the job, we've got everything that we have to deal with. And on top of that, you have this disease that's incurable. And sometimes the medications aren't working, you have pain, you can't sleep. All these things is guaranteed to cause anxiety in your life. Experiencing occasional anxiety is normal part of life. Every now and then you get anxiety, normal person gets anxiety, that's quite normal. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, panic attacks. Now, my brother and my daughter Jade struggles with intense anxiety disorders. And it breaks my heart to see them in that situation because there's nothing you can do to help them because it's there, it's right there. And they need to find the tools that work for them. It's a struggle, but if they get to that tools, it's just easier. I've seen Jade learning how to handle it and dealing with it day to day and eventually getting to a place where she can be and have a normal life. My brother, on the other hand, has been treated with medication and has also been doing very well of late and has also been going back to normal life, but still have panic attacks. These feelings of anxiety and panic interfere with your daily activities. They are difficult to control, are out of proportion to the actual danger, and can last a long time. So the actual danger may be so small, but you have this huge panic because of it. You may avoid places and situations to prevent these feelings. It's normal. Symptoms may start during childhood or teen years and continue into adulthood. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, social phobia, specific phobias, and separation anxiety disorder. So they're all basically what they sound like. Generalized anxiety disorder is you get anxiety for different kind of things. Anxiety disorder social is being in a room or a place with a lot of people. My brother has that severely. And specific phobias like agoraphobia, all these things. And then separation anxiety disorder to the people in your life, to your house, whatever it is, you cannot deal with being away from that. Whatever form of anxiety you have. Treatment can help, whether it's medication, whether it's talk therapy, whether it is studying the tools and getting tools that works for you. It can be under control. Common anxiety signs and symptoms include feeling nervous, restless, or tense, almost if your body inside of you is trembling. Have a sense of impending danger, panic, or doom. Have increased heart rate, breathing rapidly, which is also called hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than this present worry, having trouble sleeping, experiencing gastrointestinal problems, have a difficulty controlling worry, having the urge to avoid things that trigger anxiety. Several types of anxiety disorders exist. Agoraphobia is a type of this anxiety disorder in which you fear and often avoid places or situations. And that might cause you to panic and make you feel trapped and helpless and embarrassed. You just want to run into the hills. Anxiety disorder due to a medical condition. While you might have all these anxieties and this one because you have lupus, includes symptoms of intense anxiety and panic that are directly caused by a physical health problem. Because you cannot be the wife that you want to, you cannot be the mother that you want to, you cannot have a career, most of us. Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstances. Like I said, it's very small, the actual problem, and difficult to control and affects how you feel physically. I mean, your heart rate is up, your breathing is out of control. It often occurs along with other anxiety disorders or depression. Panic disorder involves repeated episodes of sudden feeling of intense anxiety and fear or terror that reach a peak within minutes. That's panic attacks. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering and pounding of the heart, palpitations, they call it. These panic attacks may lead to worrying about them happening again or avoiding situations in which they occurred because you fear them. You don't want to go through that again. Then, selective mutism is a consistent failure of children to speak in certain situations, such as school, even when they can speak in other situations, such at home with close family. This can interfere with school, work, and social functioning. With our brain fog, that happens. Separation anxiety disorder is a childhood disorder characterized by anxiety that's excessive for a child developmental level and related to separation from parents or other who have parental roles. It can work through adulthood. You can fear going somewhere without your partner, him going anywhere. Specific phobias are characterized by major anxiety when you're exposed to that specific object or situation and desire to avoid it. Phobias, phobias provoke panic attacks in some people. I know. I mean, my husband is afraid of moths, and then you must see. It feels like it looks like that thing is going to kill him. He goes berserk if a moth comes next to him. And it's actually something that's not very dangerous. But he's been like that since childhood and he's never overcome it.
Give me Eastern trimming where women are women and high silk hose, peekaboo clothes, and French fur.
Substance induced anxiety disorder It's characterized by symptoms of intense anxiety or panic that are a direct result of misusing drug, taking medication, being exposed to a toxic substance, or withdrawal from drugs. Like, for example, ecstasy, speed, cocaine, all these can cause this substance-induced anxiety disorder. Other specific anxiety disorders and unspecified anxiety disorder are terms of anxiety or phobias that don't meet the exact certain criteria of these other disorders that we looked at, but are significant enough to be distressing and disruptive. When to see a doctor? See a doctor if you feel like worrying too much and it's interfering with your work, your relationships, and other parts of your life. It's stopping you from having a normal life. Your fear, worry, and anxiety is upsetting you and difficult to control. You feel depressed, have trouble with alcohol and drug use, or have other mental concerns along with anxiety, PTSD, trauma, depression. It's all the stuff we deal with. And just like a cold, they need to get treatment. You think your anxiety could be linked to a physical health problem with us? You have suicidal thoughts and behaviors. If this is the case, seek emergency treatment immediately. Your worries may not go away on their own, and they may get worse over time if you don't seek help. See your doctor or mental health provider before your anxiety gets worse. It's easier to treat if you get help earlier. Causes. The causes of anxiety disorder aren't fully understood. Life experience such as traumatic events appear to trigger anxiety disorder in people who are already prone to anxiety. Like my husband called me years ago. I've calmed down a lot. Used to call me Stress Eddie, and it was because of the business. It was a lot of stress on my shoulders, and I think that is what really caused the anxiety. Because now I don't have the business and I don't have the anxiety anymore. But he used to call me Stress Eddie because I am really told today I'm prone to anxiety. So any traumatic event or anything will trigger an anxiety disorder within me. And inherent traits can also be a factor. I see it within my family, it's there. Anxiety in every generation, sometimes two, three people suffering with anxiety. So it can definitely be inherited. Medical causes. For some people, anxiety may be linked to an underlying health issue, like with us. In some cases, anxiety signs and symptoms are the first indicator of a medical illness. If your doctor suspects your anxiety may have a medical cause, he or she may order tests to look for signs of a problem. I've seen it over and over again. This person has a certain mental health issue, anxiety, depression, and then other symptoms with it. And then once a doctor tests for lupus, because if there's something that somebody has that they're struggling to deal with or to get an answer with, that's, trust me, test for lupus. Test for lupus is very important. My first symptoms were vasculitis on my fingers and hands. I couldn't drive, I couldn't do anything. And through that vasculitis, eventually I got to the right doctor and he actually tested for lupus and he said, you have lupus. And I think um, some of us do get the physical signs, but others may be more mental because they concentrated on that fact and forget about the other symptoms. Examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid, such as hyperthyroidism, they tend to get anxiety, lupus, RA, fibromyalgia, respiratory disorders such as chronic obstructive pulmonary disease, COPD, and asthma. Drug misuse or withdrawal from alcohol, anti anxiety medications, which is called benzodiazepines, diazepines, or other medications.
Skirts that are the homespun, but I love you longer, stronger, where your friends don't tote a gun. My
Sometimes anxiety can be a side effect of certain medication, prednisone. We tend to forget that prednisone can make you hungry, can make you angry. It can cause anxiety. It causes a rapid hair growth. Um, there's a lot of other things that prednisone can do that we are not aware of. But remember, with all its side effects and everything thrown into the mixture, prednisone is one of the only drugs that can get us out of a flare. So that is why it's so important for us. And it's also important that your doctor do not put you on it too long, because that is when the trouble happens. Because I remember when I was first diagnosed, I was on prednisone for 12 years, because I couldn't get my lupus under control. Because the moment it started, it freaked out. It freaked out completely. So they had me on prednisone. But the doctors should not do that, because then the prednisone has a less of effect. Your body gets used to it. So if you really need it for a flare that is very dangerous, your body does not react to it. So it's very important that your doctor uses it in periods of a flare, but stops it too. Then remember, we said medications. You don't have any blood relative, such as parent or sibling, with anxiety disorder, then it could be medication. You didn't have an anxiety disorder as a child. You don't have avoid certain things or situations because of anxiety. You have sudden occurrence of anxiety that seems unrelated to life events, and you didn't have previous history of anxiety. Then possibly your anxiety can be because of the medication you are taking.
it shows, and I'm all yours in buttons and bows. Give me
These factors may increase your risk of developing an anxiety disorder. Trauma, stress due to illness, stress buildup, personality, other mental health disorders, having blood relatives with anxiety disorder, and drugs or alcohol. Drug or alcohol use or misuse or withdrawal can cause or worsen anxiety. That's a risk factor. Complications. Having an anxiety disorder does more than just make you worry. It can lead to or worsen other mental health and physical conditions, such as depression, substance misuse, trouble sleeping, insomnia, digestive or bowel problems, headaches and chronic pain, social isolation, problems functioning at school or work, poor quality of life, and suicide. Treatments for anxiety. Anxiety can be treated with antidepressant medication, which do not interfere with most of your lupus medication. First line treatment of specifically anxiety is benzodiazepine, which is your calming tablets, like pronazole, chlorodiazepine, diazepam. Then doctors also use antidepressant, uh, Prozac, Zoloft, Effexor, Lexamil, because they also seem to um, work for anxiety. Then doctors use treprostinil and trazodone, which is also they a small part of them is as treatment for anxiety, and then also depression, and then also problem sleeping. So it helps for three things, and some drugs are like that. Aside from medications, there are many other ways to reduce your anxiety. Visiting a psychologist or other mental health care professional. Very, very important. You are not created to deal with a illness like lupus on your own. You have to start talking, dealing, seeing the right people. Really, you have to start looking after your mental health. It is very important, and we see and lose warriors because of it. Surround yourself with people who can ground you, people that you can trust. I've seen in my life so many people that I really could not depend on and could not trust for doing anything for me. Don't invest in such relationships. Exercise is an effective tool for management of stress. Remember, stress can cause anxiety and panic disorder. S- Exercise is a way to relieve your stress. Walking, running a bit, doing yoga, you know, um, doing something in the gym if you're much stronger. Ask Melissa Adams, she will have the right advice for you. Diet and drinking enough of water. So, your diet and your water intake is very, very important for anxiety, because certain things can cause a problem. It can worsen your anxiety. For example, colors in food, colors, dyes in food, it causes anxiety, it causes ADHD. Do your research. You'll find a lot of things. That's why we have a lifestyle video um, on YouTube. Please go to our YouTube channel and look at that lifestyle video. It's very important for every lupus warrior to start with a healthy diet. Animals can be especially effective at reducing anxiety. You can get a service animal that is teached and trained to help you. It's very expensive, and they tend not to give such an animal to lupus patients. Just a warning. But your animal at home, you get animals and you have a bond with them. And when you spend time with them and they basically take you back to a place where you are not worried, not anxious. And that is why they say animals can be so helpful to us. Don't underestimate the power of your own mind. Saying positive things to yourself can also be a good strategy for getting through anxiety. It's like I say to people, when I'm very ill, and my lupus is very active, and we are at that place where it can go anyway, then cannot, I cannot allow anything take any negative thought in my body. I can't, because the moment I do, I will get ill and I will get anxiety. I will worsen, my condition will worsen. So it's very important to stay positive. Um, it's good to complain, and it's okay not to be okay. But staying in that position of I'm not okay and not fighting back, that's a problem. You have to stand up and fight. And it's okay. Throw your toys out the cot. Um, Throw a temper tantrum with your other LUBP patients on the support groups. Say, I just want to vent, and just vent and let them hear you. They are going to give some advice. They will just love you. They won't judge you. And then, tomorrow you stand up and you fight again. That's the way we work. And another thing, get enough sleep. I know it's difficult because we have lupus, but talk to your doctor about your sleep habits and ask him to help you. The next one is prevention. There is no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take the steps to reduce the impact of the symptoms if you're anxious. Get up early, stay active, avoid alcohol and drug use. The prevention, they say get up early. Why? Because if you sleep late and you can't get everything done that needs to be done, and your whole house is out of control, that gives you severe anxiety, you know? So that's why I need to get up early. And then staying active, not lingering, and thinking about things. Stop that. Stay active. Keep your brain active. Now, the takeaways. It does not help me telling you just to see a therapist. Drink your meds, eat healthy, then your anxiety will disappear. That's a lie. Doing all the above will definitely improve your anxiety, even to you where you can, even to a point where you can have a normal day. But one thing you must remember, it takes hard work to reach a place where your anxiety is less. Choose a trustworthy family member or friend and start by discussing the causes and symptoms from your anxiety. Just the advice of a friend or the listening ear of a friend helps a lot. It's like downloading, it's very important and trustworthy people. Don't just do this with anybody. Then ignore the stigma about mental health and take charge and see a mental health professional. Your lupus can get worse if you don't get help for your mental health. And remember, lupus can kill you. Start, take the first step, choose a therapist, then your journey to healing will start. Remember, there is no other way to deal with anxiety than to get better than working through your pain with a mental health professional. Okay, that concludes this podcast. Please review it on the platform you are listening on. Please, please, please review it. Leave a comment below on the topics you would like us to talk about. If you enjoyed this podcast, please hit the like button below, follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel. Andrea's Gift, Teens and Tweens, Lupus South Africa, Susie Eagles Flight. Thank you for listening, and remember, giving up is not an option. Bye.